friends, today we are going to see about the topic called ASD, and it is one of the congenital disease. Now we are going to see the congenital diseases one by one. The first disease will be ASD. Atrial septal defect. So this is what ASD, and ASD normally we should know the normal circulation first of all. So the normal circulation is so this is a left ventricle, left atrium, right ventricle, and superior vena cava is present here, inferior vena cava is present here, and they are two input valve and two output valves are present. The two input valves are the first valve, input valve, mitral valve, and the second input valve is the tricuspid valve. Mitral valve is placed between the left atrium and left ventricle, and tricuspid valve is placed between the right atrium and right ventricle. Okay, and the two output valves, they are pulmonary valves and aortic valve. Pulmonary valve is present between the right ventricle and the lung, and aortic valve is present between the aorta and left ventricle. So this was the normal parts of the heart which we should know. So the entry of the blood will be from the upper extremities and lower extremities. Upper extremities like hands, head, neck. From these extremities, the deoxygenated blood will be collected to the superior vena cava, as well as from the inferior vena cava receives the blood from the lower extremities like legs, feet, hip. So these are the areas which the blood can be received from the inferior vena cava, and the inferior vena cava receives the blood from the lower extremities, and the superior vena cava receives the blood from the upper extremities. So directly these two deoxygenated blood will be coming to right atrium. From right atrium through the tricuspid valve it reaches the right ventricle, and from right ventricle through pulmonary valve it reaches to the pulmonary artery, through pulmonary artery, lungs. So here in the lungs the oxygenation take place. The carbon dioxide will be released out, on the oxygen is taken by the body. So there is a pulmonary vein which is present here. The pulmonary vein connects the left atrium and the lung. So through pulmonary vein the oxygenated blood will be going through left atrium, and from left atrium through mitral valve it reaches the left ventricle, and from left ventricle it will move through aorta by the aortic valve, and from aorta what happens, it will reaches to the tissues of all body parts. Tissues of all body parts, and then it continues same. So this was a systemic circulation. So now what is ASD? What is atrial septal defect? This was the normal circulation, and what is the atrial septal defect is, so between the left atrium and the right atrium there will be a shunt. there will be a shunt, a opening, okay, a defect will be there, that is known as shunt. And due to this shunt, the left atrium contracts and the blood will directly move to right atrium. When the left atrium contracts, it should move to left ventricle normally. But if the shunt, if the opening is present, the left atrium pushes the blood directly to the right atrium. So this is what the shunt. So atrial septal defect, it is a common congenital heart defect in which the shunting takes place here from the left atrium to the right atrium, and the blood will flow to the right ventricle, and more blood will go to the pulmonary arteries, more blood will be in the lungs. Okay, so this is what, so continuously this, so there is no work in left ventricle. Small amount of blood will be reaches this left ventricle, but a large amount of blood will be moving through this left atrium to right atrium. Okay, and the shunt is depends, the shunt of the blood is depends on the size of the defect. So if there is a small shunt and small amount of blood will be going through left atrium to the right atrium. If there is a large hole or large shunt, more amount of blood will be coming from left atrium to the right atrium. So this is what atrial septal defect. The septal defect in the atrial side, hence it is known as atrial septal defect. And so what I have told here, the size of the shunt is depends on the size of the defect. It depends on the size, first size, and second thing, it also depends on the reverse manner. Okay, reverse vascular resistance of pulmonary circulation and systemic circulation. So there will be a reverse, okay, there will be a reversion and reversal shunt will be there. Okay, so this is what size of the defect and reversal vascular resistance of pulmonary circulation and systemic circulation will be take place here, and depends on the shunt defect. Okay, so now there are types of ASD. Okay, I will show you. There are types of ASD. So the ASDs are okay, this is the superior vena cava which is present here. Okay, so here we have the first type is ostium primum. Ostium primum. So this is ostium primum. Ostium primum ASD. Okay, next ostium secundum. Ostium secundum. Next, sinus venosus. So sinus venosus normally divides into superior sinus venosus and inferior sinus venosus. And the last type was coronary sinus. Coronary sinus defect. Okay, so ostium primum, ostium secundum, sinus venosus and coronary sinus. These are the types of ASD. And ostium primum, it is present or it is located between the atrium, okay, between the two atrium, it is located between the two atrium. And ostium secundum, it is located in the center portion of the atrium. And sinus venosus, it is present in the malformation of interatrial septum. And coronary sinus, it is present in the defect in the wall of left atrium. If there is any defect in the wall of left atrium, the coronary sinus defect is present. Okay. So peculiarities here between the ostium primum and ostium secundum. So ostium primum is a type of ASD in which it is associated neither with endocardial cushion defect or it is associated with Down syndrome. And it also associated with mitral valve regurgitation and tricuspid valve regurgitation. So ostium primum, it is associated with endocardial cushion defect, Down syndrome, as well as mitral valve regurgitation and tricuspid valve regurgitation. Any one of these defect, it is associated. And coming to ostium secundum, it is also the type of ASD and it is transmitted as autosomal dominant condition. Okay. So this was the peculiarity of ostium primum and ostium secundum. Coming to pathophysiology. Okay. Here in pathophysiology, I want to draw the same diagram here first. Okay. In atrial septal defect, the pathophysiology will be, so if there is a shunt between left atrium and right atrium, the blood will be directly going through this, okay, and it will reach the right atrium. So more blood will be coming here, then right ventricle, then it will move to pulmonary valves. And what happens, it will move to the lungs. Okay, so here what happens, the right atrium become enlarged if more blood comes, the right ventricle become enlarged and pulmonary arteries become enlarged, the pressure in the pulmonary valve become more and the lungs also become collapsed, and oxygenation or carbon dioxide, there is a difficulty in exchange, and what happens, there will be a reverse through pulmonary vein, it reaches the left atrium. So from left atrium again this continues. The oxygenated blood and deoxygenated blood get mixed. Okay, hence it causes also cyanosis, but it is not a cyanotic heart disease. And what happens here? Again the shunt, again the reversal causes, okay, hence it is known as reversal shunt, and this reversal shunt is also known as Eisenmenger syndrome. Okay, so this is what the pathophysiology. And coming to symptoms, so symptoms are first asymptomatic normally, and there will be a breathlessness and tiredness will be there, as well as the main thing here it causes is thrill, systolic thrill will be there. So during this ventricular contraction happens, there will be a thrill in the vessels, okay, and as well as there will be a wide fixed splitting of second heart sounds. So in this normally, see, expiration will be occur like this and inspiration will be like this. okay, in wide and fixed. Okay, so here this is a wide and this is the fixed. What happens in the atrial septal defect is splitting of wide and fixed of second heart sound. So splitting will be occur. Splitting means, so this will be leads to here and this leads to somewhat okay, this is what splitting. So wide splitting, wide and fixed splitting during the second heart sound. Okay, and then the systemic flow will be over the pulmonary valve. This is what the symptoms normally. Okay, and coming to diagnosis, so in X-ray there will be enlargement of heart, enlargement of pulmonary arteries will be there, and pulmonary plethora mainly. So pulmonary plethora means there will be increased perfusion, more amount of blood circulating in the lungs. So that is pulmonary plethora. Okay. Next in ECG. In ECG what happens? There will be a incomplete R triple B. Incomplete R triple B means incomplete right bundle branch block. Okay, and clot will be produced in lungs. Blood clot will be produced in lungs because more amount of blood are pushed to the lungs and there is no blood going to the tissues and other parts of the body. Reversely, they are circulating in the heart itself. Okay, so what? It causes clot in the lungs. And in echo, we can see RV dilation. So there will be filling of RV, that is left ventricle, and it become dilated and causes hypertrophy. Okay, that is RV means left ventricle. So RV dilation and hypertrophy. Okay, so management, next management will be, medical management is not suitable for this defect because medical management can't do anything, only surgical management can be done. So the first surgical management will be catheter implantation. Catheter implantation on closure device. And the second one is surgically we can do with the from 3 to 6 years children. Okay, from 3 to 6 years children, ASD closure can be done. We can close this shunt by doing surgery. Okay, so this is what ASD means. So definition and what are the types, and we explained the types there, what are the peculiarities between the ostium primum and ostium secundum, and we have seen about the pathophysiology as well as symptoms, signs, and what diagnosis, and last it leads to management. So this is what ASD is, and then the next video I will be taking about VSD, ventricular septal defect, where we can easily shower up that VSD will be at the ventricles. So the shunt between the left and right ventricle is known as VSD. That's it. And we can read more about VSD on next video. I will see you. Okay, until then, bye.